Welcome to NCM110, Nursing Informatics. Information Technology System applicable in nursing practice. Critical care nursing is an area of expertise within nursing that focus specifically with human responses to life-threatening problems. Critical care nurse is responsible to ensure that critically ill patients have seriously conditioned individuals. Ensure that families of the medically ill patients should receive optimal care. Rely a dedicated knowledge, skills, and experience, and of course, automated system of support and intelligent system to provide care to patient and families and create environments that are healing, compassionate, and caring. Critical care applications. Areas where patients require complex assessment, high-intensity medication, continuous therapy and interventions, and unrelenting nursing attention and continuous watchfulness. Critical care applications should provide all caregivers access and track patient information, including medications, monitor readouts and charting, patient progress, and other nursing and procedure documentation, facilitates acquisition, validate and reliability of critical patient outcome data and reporting. Critical care information system provide real-time resource utilization data and management of information and access critical care areas through the integration of the medical facilities in the critical care or intensive care unit to an intelligent computer system which is capable of processing all data. Enables the electronic collection of hospital and patient-specific critical care data of the entire patient in the critical care areas, which can be processed to create a patient profile which generate real-time and historical report on indicators including bed occupancy, delayed discharges, readmission rates, and outcomes. Automated collection and management of medical information will become the important task of the critical care information system. To summarize critical care information system, it is the most comprehensive source of province-wide information on access to critical care, quality of care, and outcomes for critically ill patients. This can be a computer software systems specialized for supporting the data processing tasks. Community Health Application System. Community Health Application System, collective term for the methodical application of information science and technology to community and public health process. Encourages optimal application of computer system, computer programs, and communication system for the benefit of majority of individuals, families, and community. Nursing informatics in community healthcare has so much to offer. It can help to provide support and improve collaboration among the doctors, community health provider, and patients. This is also useful in monitoring and tracking the health status of the community. It will also help community health worker in making updates of the patient's profile. They don't need to do tons of work if nursing informatics will be used in community health sector. Focuses on the health information system of the community. It is centered on the majority part of the public. Emphasizes the prevention of the disease, medical intervention, and public awareness. Fulfills a unique role in the community, promoting and protecting the health of the community at the same time, maintaining sustainability and integrity of health data and information. Advantages of using this system involves tracking and detection of the disease in the community will be easy because we can easily track the spread of it, and the communication among the nurses and other healthcare provider will be strong. Ambulatory care systems. Ambulatory care refers to medical services performed on an outpatient basis without admission to a hospital or other facility. Ambulatory care is provided in settings such as dialysis clinics, ambulatory surgical centers, hospital outpatient departments, and the offices of physicians and other health professionals. 8 types of ambulatory care settings. We have the smartphones, computers, and the internet. Mobile care, convenient care and retail clinics, urgent care, freestanding emergency departments, work-based clinics, primary care clinics, and specialty care and high-tech centers. Smartphones, computers, and the internet. The most prevalent care site is the internet, whether patients are in touch with their care providers through portals or medical websites. New apps and smartphone accessories likely will increase healthcare providers' ability to monitor, assess, and care for patients in their homes and offices. Consistency of the patient experience across physical and digital platforms is both a significant challenge and a design opportunity for providers. Mobile care. Historically, mobile care has consisted of converted buses used as part of charitable outreach programs for patients who otherwise would not have access to care. New models of mobile care are beginning to arise and compete on the basis of convenience. Driverless vehicles also may provide care environments that come to patients, equipped with technologies beyond those available at home or office, even if they don't come with a care provider. Design may be a factor in acceptance, especially among younger patient consumers. Convenient care and retail clinics, typically located in existing retail drug and big box stores. These clinics treat a limited number of conditions and are staffed by mid-level providers on a first-come, first-seen basis. Though there is some experimentation with scheduled appointments, the costs of services typically are posted and make it simpler for consumers to understand their obligations. Ease of parking, long weekday and weekend hours, and one-stop shopping for over-the-counter items make these sites appealing for many patients and explain their exponential growth from 1,200 sites in 2013 to 6,000 projected by 2018. Urgent care, often defined as clinics that provide general radiography, a small lab, sutures and extended hours. Urgent care clinics now exist as both part of larger healthcare systems and for-profit companies. They are likely to be increasingly connected to both as healthcare systems realize that they may not be able to provide the desired number of sites or operate them as efficiently as for-profit companies. For example, in 2014, Massachusetts General Hospital announced an affiliation with MedSpring Urgent Care with physicians at these sites who would be fully MGH accredited. Services may include scheduled as well as unscheduled visits, with extended hours and physicians in attendance in addition to physician assistants and other mid-level medical staff. For healthcare systems, the urgent care clinic is an opportunity to extend the brand. Freestanding emergency departments, often part of healthcare systems that can accommodate patients who require admission. Freestanding emergency departments provide services that fall between those of urgent care clinics and hospital-based emergency departments. Open 24/7, freestanding emergency departments typically do not include the full range of imaging modalities, lab capabilities, or observation beds, though this may change. Some freestanding emergency departments are part of larger ambulatory care centers. Work-based clinics. The long history of work-based clinics, which began in the 1860s, has gained traction over the past decade as a way to keep employees healthier and more productive. It's not just manufacturing companies that see the value in work-based clinics. Silicon Valley employers understand that many of their employees don't want to bother leaving the company grounds for care. As recent college graduates, many may treat this as an extension of campus healthcare. 37% of organizations with 5,000 or more employees have work-based clinics, with a workforce of approximately 1,500 considered the minimum for cost effectiveness. Primary care clinics. Growing in size and displacing the single or paired primary care physician model, primary care clinics now focus on team care that may include more collaborative spaces to support medical homes and group visits. As primary care becomes folded into larger systems, some specialists, that is, endocrinologists, cardiologists, may be part of the team to provide more comprehensive care, and limited diagnostics may be required on site. Exam rooms increasingly are designed for a consultative model of care in which the patient may stay sitting up and dressed, with access to a video screen for a telemedicine conference with a specialist in a remote location. Specialty care and high-tech centers. Pediatric and adult models of specialty care may be different in regard to size and imaging capability. A significant number of pediatric patients have weekly or monthly visits, as well as appointments with multiple providers on the same day. Unlike pediatric specialty centers, which may have limited imaging in all but larger cities due to issue of sedation and critical mass, adult specialty centers are often billed as hospitals without beds and may combine sizable surgical suites, comprehensive ambulatory cancer care, and a full range of imaging modalities. Design elements increasingly follow the retail models of creating spaces and events where people want to spend time, such as farmers markets, gardens, courtyards, and other places that aren't traditional waiting rooms or lobbies. Transforming emergency preparedness and response. During a disaster situation, the use of telehealth technology would allow clinicians to provide healthcare services remotely. A locally based network of clinicians linked via modern communication would help reduce major disruptions in healthcare. Protocols need to be developed for mobile communication devices before disasters so they can be rapidly deployed to provide routine care, triage, and shelter-in-place medical care. Advanced wireless electronic technologies are the quickest vehicles to communicate needs during emergency situations. State, federal, and international emergency efforts have not evolved as rapidly as these new technologies. Assistive devices and technologies. Assistive devices and technologies are those primary purpose is to maintain or improve an individual's functioning and independence to facilitate participation and to enhance overall well-being. They can also help prevent impairments and secondary health conditions. Some examples of assistive technologies are mobility aids such as wheelchairs, scooters, walkers, canes, crutches, prosthetic devices, and orthotic devices. Hearing aids to help people hear or hear more clearly. Cognitive aids, including computer or electrical assistive devices to help people with memory attention or other challenges in their thinking skills. Computer software and hardware such as voice recognition programs, screen readers, and screen enlargement applications to help people with mobility and sensory impairments use computers and mobile devices. Tools such as automatic page turners, book holders, and adapted pencil grips to help learners with disabilities participate in educational activities. Closed captioning to allow people with hearing problems to watch movies, television programs, and other digital media. Physical modifications in the built environment, including ramps, grab bars, and wider doorways to enable access to buildings, businesses, and workplaces. Lightweight, high-performance mobility devices that enable persons with disabilities to play sports and be physically active. Adaptive switches and utensils to allow those with limited motor skills to eat, play games, and accomplish other activities. Devices and features of devices to help perform tasks such as cooking, dressing, and grooming. Specialized handles and grips, devices that extend reach, and lights on telephones and doorbells are a few examples. Telehealth. One of the latest trends in healthcare IT is the concept of bring your own device or BYOD. In many hospitals, the IT department has already ensured that their devices are secure and able to meet government regulations. Back-end IT systems are required to ensure that a given device does not introduce vulnerabilities into the system. Mobile device management products provide policy enforcement on end-user devices, remote wipe capability, and endpoint integrity. To implement BYOD, owners of the devices must be willing to abide by the hospital's mobile device policy and allow their devices to be managed. As the concept of unified communications continues to grow, fed by the challenge to attain work-life balance, BYOD is becoming increasingly attractive in many organizations. Major technology trends. We have the wireless patient monitoring, mobile system access, medical devices, virtual consultation, and aging in place. Wireless patient monitoring. Technologies that enable remote surveillance of patient vital functions through the use of internally and externally located patient devices. Examples: wirelessly monitored pacemakers and automatic defibrillators. Mobile system access. Mobile technologies that enable remote or virtual access to current clinical systems such as electronic health records and picture archiving and communication system. Examples, websites, portals, and mobile apps. Medical devices. Mobile or wireless-enabled technologies that capture and track key care compliance and disease management data. Examples, digital glucometers, blood pressure devices, and pedometers. Virtual consultation, remote connectivity, and multimedia solutions that enable virtual care consultation, education, and therapy. Examples, teleconsultations, mobile video solutions. Last, we have the aging in place. Remote technologies that enable clinically monitored independent living for aging populations. Example, personal emergency response systems, video consultations, motion or activity monitoring, fall detection, aggregation, and transport.